5 early signs can show Wegovy or Zepbound is already working before the scale moves. Wegovy contains Semaglutide, while Zepbound contains Tirzepatide. Hunger may arrive later, portions may shrink, and food may stop demanding constant attention. Appetite control often changes before enough body fat disappears to move your weekly average. Water, salt, and digestion can hide progress even while treatment is changing your behavior. A bathroom scale shows body weight, not whether appetite control is improving. Early changes may appear first in hunger, portions, and eating habits. Those changes can become visible before they create a clear weekly weight trend. Wegovy and Zepbound work differently, but both strengthen signals that tell your brain when you are full. Hunger often becomes less urgent, and satisfaction may arrive with less food. That shift can happen before enough stored fat is used to create visible scale movement. The useful question is whether hunger and eating are becoming easier to manage, not harder. The first sign is that hunger arrives later than it used to. Breakfast may carry you closer to lunch. An afternoon snack may stop feeling mandatory. The change should feel calmer, not like severe nausea blocking all food. Track the time between a normal meal and the return of clear physical hunger. Compare similar days rather than one unusually busy morning. A consistent delay suggests stronger fullness signals after eating. Physical hunger builds gradually and accepts several food choices. A craving usually points toward one specific taste, texture, or reward. Either medicine may weaken both, but delayed physical hunger is the more reliable early sign. The second sign is that a smaller portion feels complete. You may leave several bites without forcing yourself to stop. The meal ends because satisfaction appears earlier, not because a rigid rule tells you to quit. This can be easy to miss when portions are served automatically. Use the same bowl or plate for 1 week. Notice whether the amount that once felt normal now feels excessive, comfortable, or simply unnecessary. A useful comparison separates two people with identical scale results. One still fights through every meal and thinks about snacks all evening. The other stops comfortably, forgets the pantry, and eats less without constant effort. The scale may move later, but the second person is already eating with less effort. The third sign is quieter food noise. Food noise means repeated thoughts about eating when the body does not clearly need energy. Menus, leftovers, office snacks, or evening television may stop triggering the same mental pull. You may still enjoy food, and you should still plan balanced meals. The difference is reduced pressure. A cookie can remain on the counter without becoming a debate that occupies the next hour. Quieter food thoughts should not be confused with feeling too sick to eat. Vomiting, severe discomfort, or being unable to eat enough is not successful appetite control. Side effects can reduce intake temporarily while making treatment unsafe or impossible to sustain. This distinction matters because many people treat stronger side effects as proof that Wegovy or Zepbound is working. They may even welcome worsening nausea when appetite disappears. Effective treatment should make choices easier, not make normal eating feel physically punishing. Persistent vomiting, severe abdominal pain, dehydration, or worsening weakness need medical attention. Do not raise the dose simply because the scale paused. Dose decisions should follow the prescribed schedule and your clinician's review. With safety addressed, sign 4 is less grazing. You may pass the kitchen without grabbing something. Evening grazing may shorten. A stressful phone call may no longer lead automatically to chips, sweets, or another meal. This sign differs from smaller portions. Portion control changes what happens during a planned meal. Fewer eating episodes change what happens between meals, when habit and reward often add unnoticed calories. Count unplanned snacks for 7 days without judging yourself. Compare that number with your usual pattern. A drop from daily grazing to occasional snacking can matter before body weight reflects the accumulated difference. The fifth sign is steadier blood sugar after meals, especially if you also have type 2 diabetes. Wegovy or Zepbound may reduce the rise in blood sugar after a meal before the scale changes. Without diabetes, The first four signs are usually more useful than blood sugar readings. Use readings only when your clinician has recommended monitoring. Compare similar meals at similar times. One lower reading proves little, but a repeated pattern may show better blood sugar control before meaningful weight loss appears. People using insulin or certain insulin-releasing diabetes pills may face low blood sugar as eating decreases. Sweating, shaking, confusion, or unusual weakness need prompt attention. Medication doses sometimes require adjustment by the prescribing clinician. Look for a pattern across several weeks, not one dramatic day. Hunger, portions, food noise, and snack frequency should become easier to manage. Blood sugar adds another signal when monitoring is part of your care. No single sign proves the dose is right. These signals are most useful when daily routines stay comparable. Illness, skipped meals, travel, and severe stress can change appetite independently. Look for changes that continue through ordinary workdays and weekends. Because both medicines are weekly injections, note whether hunger changes across the week. A repeated pattern near the next dose gives your clinician useful context. Record it, but never shorten the interval or add medication yourself. A weekly record helps confirm whether the pattern repeats. Record morning weight under similar conditions 3 times weekly. Also note meal size, hunger timing, unplanned snacks, and side effects. Constipation can hold extra stool and water, especially after treatment begins. Menstrual cycle water retention, higher salt intake, travel, and hard exercise can also raise scale weight temporarily. None of those changes directly measure body fat. Average the readings instead of reacting to the highest number. Weekly averages reduce distraction from water shifts and reveal slow progress when daily numbers move in both directions. Waist measurements add context but should not replace the scale. Measure at the same location and time each week. Small differences in tape placement can create false improvement. For both Wegovy and Zepbound, early doses help your body adjust rather than produce maximum weight loss. Some people notice appetite changes quickly, while others respond after prescribed dose increases. A quiet first week does not prove treatment failure. However, months without improvement in appetite, eating patterns, weight, or monitored blood sugar deserve review. The reason may involve dose, injection technique, another medicine, sleep, eating habits, or a different medical problem. Bring the record to that review. It gives your clinician more than one scale number and shows changes in hunger, portions, habits, blood sugar, and side effects. The real goal is enough control to choose balanced meals without constant pressure, not feeling nothing around food. Protein, fiber, fluids, and regular meals still matter because reduced appetite can reduce nutrition. Protect muscle with protein and strength exercise, such as weights or resistance bands, when appropriate. Fast weight loss with very little food can sacrifice muscle. A smaller number is not automatically a better result. So look before the scale. Later hunger, smaller satisfying portions, quieter food noise, fewer unplanned snacks, and steadier blood sugar after meals are the 5 early signs. When those patterns repeat without severe side effects, Wegovy or Zepbound may already be changing the process that drives weight loss. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.